What causes behaviour? Sensory processing issues. Problems with sensory processing can lead to sensory overload, hypersensitivity, or sensory seeking behaviour, hyposensitivity. Hypersensitivity and hyposensitivity can relate to all senses: vision, hearing, touch, taste, smell, proprioception, which is body position awareness, and the vestibular system, which accounts for balance and spatial orientation. Sensory processing usually occurs automatically. We learn things through our senses and how our body fits in and functions in the world. Some people with autism have trouble organising and responding to information from the senses. Sensory issues range from quirks that we can all experience to severe disruption. Some children with autism can be both hyposensitive and hypersensitive. Hypersensitivity. Hypersensitivity refers to having an extreme sensitivity to stimulation of the senses. A child can be overly sensitive in one or several of the 7 senses. Hyposensitivity. Hypersensitivity occurs when a child is underwhelmed by his environment and needs to seek out additional sensory information to feel satisfied. Again, a child that is hyposensitive might have issues with one or several of the 7 senses. It is important to look at the environment in relation to any difficulties it might be creating for the child. The environment can sometimes be altered to help the child with any sensory processing issues they might have. For instance, lighting can be altered or volume can be reduced or increased. Alternatively, social stories or visual prompts can be used to prepare a child for environments that cannot be altered. We believe that a careful assessment of the person's sensory sensitivities should be carried out by a trained professional before any sensory intervention is applied. However, some of the following information may be helpful. Hypersensitivity intervention. Look at the environment around you. What can you change? Smell. A child might find certain smells overwhelming. Make the environment as fragrance-free as possible. Sound. Sounds of a particular volume or pitch can be extremely distressing for children who are hypersensitive to sound. Cut out conflicting sounds by closing windows and doors and reduce volume. This can help to reduce distress. Sight. Certain bright lights, such as fluorescent lights or sometimes the sunlight, can be difficult for a child who is hypersensitive. When possible, avoid fluorescent lights or bright lighting. Use low wattage bulbs and provide a quiet, dark space in the home where the child can go if they feel overwhelmed. Taste. It is common for a child with autism to be a plain eater. Dry, white, crispy foods are often all some children will eat. Some foods have too strong a flavour. It is okay for the child to eat plain foods, but it is important that they get the necessary dietary nutrition they need. If there is any concern, professional advice from a nutritionist is advised. Other foods can be introduced, but this is normally done in a very gradual and limited way, and under the advice of a professional. Touch. The slightest touch for some children with autism can feel painful. It is important to forewarn a child if you are going to make physical contact. Some materials, as well as tags and seams on clothing, can also be extremely irritating. Removing tags and buying clothes that do not cause irritation can make a big difference to a child who is sensitive to touch. Proprioceptive avoidance. Children who have problems with proprioception are often clumsy. They bang into things and find it difficult to hold things properly. Both fine and gross motor activities can help to develop proprioception. Fine motor activities include lacing boards, pegboards, and wooden puzzles. Gross motor activities include running, jumping on a trampoline, climbing, or any playground activity. Vestibular system. Balance and spatial awareness issues can be common in children with autism. Engaging in everyday play activities that allow for gross motor movement can help to develop a child's vestibular system. Most playground activities are ideal. Hypersensitivity intervention. Smell. Children with autism are sometimes undersensitive to smell. They seek out smells. Make different strong scented objects available that the child can access when required. Sound. Hearing may be limited, so volume may need to be increased, or visual supports can be used to back up verbal information. Sight. For some children, objects may appear dark, blurred, or lose some of their features. They can also have poor depth perception, which can lead to clumsiness. A child might seek out bright objects or light. Simple, clear visual supports may help if the child is having difficulty with vision. In some cases, it may be necessary to get advice from an optometrist. Taste. Some children can be undersensitive to taste and may seek out strong flavours or eat inedible items such as earth. Replace the item with an appropriate alternative, such as something crunchy or a chewy tube. Healthy, strong tasting foods can be provided. Make sure the child has some dietary variety. Touch. Children with autism can be undersensitive to touch. They may seek out deep pressure by holding others tightly. Weighted blankets or hugs can be provided for deep pressure. Professional advice is advised. Sometimes a child needs to touch or put different textures in their mouth. Chewy tubes or crunchy foods can help with mouthing. In some cases, children may smear feces. Water, sand, or other textures can be provided to give the child the sensory input they need. Some children who are hypersensitive to touch may also be indifferent to pain. Social stories and visuals can be used to teach danger. Proprioception. Some children have difficulty judging their proximity to others or how much pressure they need to apply to something. They may also have difficulty navigating their way around obstacles. Playground activities such as swings, slides, trampolines, as well as running, jumping and push and pull activities will help to stimulate the muscles and joints and provide proprioceptive input. Vestibular system. Some children have difficulty with balance and spatial orientation. They often rock or spin to get the sensory input they need. Gross motor activities that can be carried out in a playground are again recommended to help with balance and spatial orientation. Some children will find some of the above activities difficult, so it is important to assess how the child copes with each activity and to move slowly. If you are unsure, an occupational therapist will assess what a child needs in relation to any sensory difficulties they may have. It is important that the correct intervention is applied, as the wrong intervention may cause more harm than good.